Hi, I'm Emma Fields, and I'm a radiation oncologist at VCU Massey Cancer Center. I specialize in treating gastrointestinal and gynecologic cancers, and I'm one of the members of the group of radiation oncologists here. I wear many hats and have different roles in the cancer center, some of which are involved in resident education and teaching, as well as in protocol design and development. Today, I'm going to give you an overview of radiation oncology and the ins and outs of radiation therapy, in case that'll be part of your treatment or someone in your family's treatment moving forward. So here's an overview of what I'm going to talk to you about. First of all, we'll talk about what is radiation and how it works. We'll also talk about the experience, what it's like to receive radiation therapy and any side effects that might be encountered. And then we'll talk about the types of radiation therapies and which cancers those are used to treat. So radiation actually has a long history. X-rays were discovered back in the 1890s. You may have heard of Marie Curie. She discovered radium also in the 1890s, but it wasn't until the 1940s that we developed machines that were able to treat cancer patients. Initially, these were with radioactive sources, such as cobalt. And then you can see as better imaging techniques developed, radiation therapy kind of grew and developed with that. Now we use really fancy radiation, including intensity-modulated radiation therapy. We also can use image guidance, which means we can see what we're treating before we turn the machine on. And that image guidance can include things like a CAT scan or even an MRI scan prior to treating. And moving forward, radiation is now being used in combination with many different systemic therapies, including some of the targeted agents that are used in cancer care. And we're even treating and curing people with stage 4 or metastatic cancers. So how does it work? The X-rays that are generated in these big treatment machines are X-rays just like are used if you were to break a bone and have a regular X-ray, or go through a CAT scanner for a chest image. And they're produced in this machine here, which is called a linear accelerator. And what that means is it just accelerates the X-rays so that they're a high energy. And they're really high energy, higher than those that take pictures. And because of that, instead of just taking pictures, they're able to cause damage to the DNA of cancer cells. And we're able to target the X-ray beams exactly where we want them. Radiation oncology is just one of the players in the cancer center. We work in conjunction with surgical oncologists of various different types, including urologists, gynecologic surgeons, colorectal surgeons, and liver transplant surgeons, many different types. And obviously there's plenty of different types of surgeries that are available. Similarly with medical oncology, there's standard chemotherapies, now immunotherapy and hormonal therapies, as well as other targeted agents. Radiation oncology, just the same, has different types that we can use depending on what's necessary. Our bread and butter treatment is called external beam radiation. And that's probably what you think of if you've heard of somebody getting radiation. That's the daily treatment where a patient would come in once a day for multiple rounds, sometimes for several weeks at a time, and lay on one of those big machines called the linear accelerator. Stereotactic radiation is a newer technique and has specific indications where we might pinpoint on something very small. It's typically treatment that's given at a higher dose per treatment and in lower numbers of treatment. We'll also talk a bit about brachytherapy, and that just means radiation given at a short distance. So it's where we might put a radioactive source next to a tumor. And here at Massey, that's one of the things that we really specialize in for many different types of cancers. So why do we need to add radiation when we already have surgery and chemotherapies? Well, here's just an example. And this is an example in the brain, but really it's an example that applies anywhere in the body. You can imagine if this blue area would be a tumor, the first thing that we might want to do would be remove it. But as we know, in many areas of the body, it's really hard to remove the entire thing because some of these edges, you can't even see tumors. And also you might not be able to remove that big of an area of the body. So you can always add chemotherapy, which travels through the body, typically, through the blood vessels, and sort of gives a blanketing area to kill cancer cells. What radiation can do is really hone in on the area around the surgery to try and clean up any disease that's left behind after a surgery has happened. And this is just one type of using radiation. Sometimes we use it on its own without any surgery and without any chemotherapy. Sometimes we use it before surgery. And sometimes we even use it just to make people feel better if they have cancer in parts of their body and are having pain. So the radiation oncology department is quite large. I always say it takes a village to give really high quality radiation treatment. So you as the patient or patient family member will interface with all of these people when you come for your treatment. Obviously, you start off by meeting people at the front desk. Also, you're going to meet nurses and your physician. Often here at VCU, we also have resident physicians as well as medical students, as we are an academic teaching center. And then we have various types of therapists that walk you through the actual treatments. So we have people who are responsible for getting you in the right position each day. Oops, sorry. First of all, those are the CT simulation techs, and I'll tell you what that's all about. And then the therapists are for the daily treatments. There's also all these folks behind the scenes, including dosimetrists who plan the radiation. They actually figure out where the beams have to go to maximize dose to the tumor itself and minimize dose to the surrounding structures. And then there's physicists who make sure everything runs exactly as we want it. So they check the machines every day. They check the treatment plans before we start anybody, and so are really integral to the safety of the treatments. So how this works after you or when you walk into the department, like I said, you're going to meet with the front desk staff, nursing, perhaps a resident, as well as an attending radiation oncologist. Typically, we start by going over your history and performing a physical exam. We will have already looked up all of your information, so you don't need to bring anything with you for that, except maybe some medications that you're on if you've started something new. And then we'll go through why we think radiation might be important in your particular situation. These are just some things that we might talk about and also good things to keep in mind for questions to ask. How many treatments you might receive, as well as the common and uncommon side effects. Now, it's important to remember the side effects to radiation are not the same for each individual person and each individual disease site and treatment type. So make sure that you ask your doctor this as opposed to just looking online. The next step after your consultation will be to plan to come in for a CT simulation. Now, this is just really a fancy CAT scan or CT scan. And the purpose of this is to take your personalized anatomy and get it into our treatment planning system so that we can customize the radiation treatments specifically for you or your loved one. What we do at this time is we make a custom immobilization device, which I'll show you in the next picture. And then we place some tattoo marks on your skin after you've gone through the CAT scanner. Sometimes we give IV contrast. Sometimes we even have you drink some of that contrast like they do in radiology, but we'll tell you all of that ahead of time. It's important to know that you almost always can eat and drink before these appointments. So your doctor should mention if that's not the case. These are some of the common things that we use to immobilize patients. And it really just depends on the part of the body, how mobile it is, how much it moves, and how pinpoint the treatment is. Some of these look a bit more intimidating than others. Right in the middle on the top, this is a mask that we use to treat head and neck cancers, so tonsil, throat, voice box, things like that. Excuse me, some of these pictures on the left are for treating breast cancer. So this black device is a standard breastboard, which just allows the patient to sit up just a little bit. We also have one that we call a prone breastboard, and what that means is you're just laying on your tummy, and the breast that's being treated kind of falls through this opening. And that's really nice to move away the other breast, move away the heart and the lungs, because obviously what we're trying to do with radiation is target where we want to treat and minimize dose to anything else in the body. Similarly, in the bottom middle, this is a belly board. So this is often used for gastrointestinal cancers, where the head goes at the top, the belly falls down into the middle. There's even a cutout for genitals for our male patients. And again, that minimizes dose to those structures. These other pictures are examples of some of the molds that we use that just hold you in a steady or consistent position throughout your treatments. And those are custom made for each person. That whole procedure takes about 1 hour. If we're doing something super specialized, sometimes it can take up to 1 hour and a half. But like I said, there's usually not preparation for that. And at the conclusion of that appointment, you will get tattoo marks. Typically, there's between sort of 3 and 5 tattoo marks. And they're not always exactly where we're aiming the radiation. Oftentimes they're close, but they're not indicative of exactly where we're targeting. So don't worry if they're not, exactly where you imagined. Oftentimes there's some lines that you'll see on your skin as well. Feel free to shower after this appointment. You can wash those off. These little tattoo marks that we actually need won't go anywhere. And those are used every day when you come into the treatment machine. There's some lasers in the room that match up exactly like they did in that CT room. So we can set you up in the same position every single time you come. And that way we can take our x-rays and be pretty close to where we're treating, so we minimize how long you have to lay on these hard tables. After that mapping is done, you'll leave with an appointment to come back and start your treatment. And then behind the scenes, this is where our work really begins. So we will take your CAT scan, import it into our planning computer systems, and we actually get to color. We draw out exactly where we want to give the radiation. So this example on the left here is a breast cancer. And you can see we've got a red line around where a breast tumor was removed. And then the shades of pink and purple are sort of a margin or expansion that we add, because that's really the area that we want to clean up after the surgery. We also draw out the entire breast. Typically we draw out the other breast, not shown here. And then we draw out the heart and the lungs so that we can track how much dose is going, and we have acceptable constraints and limits so that we do this in an incredibly safe manner. This other picture is just looking head on, and you can see sort of in the region of the armpit, that's where some of the lymph nodes might sit. And so in somebody where they maybe had a lymph node that we were worried about, we might add radiation there to kind of clean up or ensure the lowest chance of this coming back. So after we've done our drawing or contours, what we've done will then go to our dosimetry team, and they will then work with us to figure out exactly how we should set the beams to give the best sort of ratio of treating the cancer and minimizing dose to everything around. And like I said earlier, everything's checked and double checked before you start treatment to make sure everything's exactly right. And so that's why between simulation and actually starting your treatment is usually about a 1 to 2 week window. Of course, there are exceptions to that, things that we consider more emergent, and we can definitely expedite that process. So again, most patients receive what we consider that bread and butter treatment with the external beam radiation, and another picture here of that linear accelerator. Like I said earlier, the linear accelerators are managed by a team of radiation therapists. So typically there's 2 to 3 of those at each machine. Here at the main site, we have 3 different treatment machines. We also have treatment machines at Stony Point and at Memorial Regional Hospitals, as well as several others in the greater Richmond area. And so the therapists are who you're going to interact with on a day-to-day basis. And they're in charge of basically setting you up in the treatment position. So that typically involves checking in at the front desk, changing into a gown, if that makes sense for the body site we're treating. They set you up in your custom device, whatever we made at the time of your mapping. And then they will take x-rays to make sure that we're in exactly the right place. Depending on how pinpoint we are, the treatment length will vary somewhere between typically 10 minutes all the way up to about 1 hour to 1 hour and 15 minutes. We don't like to leave you on the table much more than that, because obviously if we're going for precision, we don't want to leave you in an uncomfortable position. So definitely let your therapist know how you're feeling and what we can do to make you more comfortable during this procedure. Like I said before, each time you come in for daily treatment, you check in with the front desk, but it's a quick check-in, no paperwork. You don't go into the clinic. You just sort of say, I'm here. They have you get changed if needed. Oftentimes the first day is the longest because we take the most setup pictures just to make sure everything works perfectly before we give you that first treatment. Sometimes after your first treatment, in addition to the tattoo marks you already got, we may add some additional paint marks on your skin, and we'll put little stickers over those. The therapist will remind you, but those are marks that we really want you to keep on because those will speed up the process for subsequent days. And they're actually pretty hard to get off. I have some people after treatment ask me actually to remove those. So when you're done, you can certainly peel them off. Let's see, each appointment, like I said, is somewhere between, well, I said 10 to, 75 minutes, but the majority of appointments are probably in that 15 to 30-minute window. And the treatment itself is very quick. We can see and hear you the whole time you're being treated. So if you need anything at any point, we can come in, but there will not be anybody in the room with you while you're being treated. The actual experience when you're being treated, I always tell people, it's very nerve-wracking to hear about getting radiation treatment, but it's actually quite boring. So you just lay on the table. You really can't see anything. You don't feel anything when the treatments come on. You don't feel hot or warm, and you don't smell anything. You do hear beeps and buzzes of the machine moving around you. And there's a beep outside of the door, just letting people walking by know that there's radiation in use. But once the treatment's done, there's no lingering radiation. So you're never radioactive during this procedure. So you're safe to be around children, pregnant women, elderly people, people with weak immune systems. And typically it doesn't affect your own immune system. But obviously that can vary depending on what other treatments you're getting, specifically if you're getting some additional chemotherapy. So just check with your doctor. This is just some pictures that I took of our linear accelerators. This is one of our machines on the right. This is called the TrueBeam machine. It's one of the newer options that we have. So you would lay sort of where my arrow is, and then the radiation comes from this big round structure at the top. These arms that are sort of on the sides, those are what are actually taking the pictures. So they're similarly x-rays, but they're not quite as high energy. So we can actually take really good x-rays and CAT scans before we turn on the treatment, depending on what we're looking for. And then this is what it looks like outside of the room on the left. So again, we can see and hear you on the cameras, and we're taking x-rays to set you up. And these are run by our therapists. So typically, you will see your radiation oncologist at least once a week for a doctor's visit. And that's nothing that you need to schedule. The therapist will just send you over to clinic on one day a week, and you'll kind of get used to what day that is. For example, I see my patients on Mondays after their treatments, but luckily, I'm physically here 5 days a week. So if anybody needs anything, I encourage them to just speak up and let us know. As I said at the beginning, we all have residents as well as nurses. So there's loads of people who will know you and be able to support you through this treatment. But when you have those preset visits, it's a really good time to come with perhaps a family member if you like. It's a great time to discuss any issues that you're having, or anything you might anticipate going into the next week. Sometimes we get some blood work at those visits, and oftentimes we'll look at the area that we're treating to make sure that your skin looks good and everything's going as planned. So speaking of looking at your skin, the radiation side effects that we expect, like I said, really depend on where we're treating. However, universally, radiation treatments, I will say, can cause tiredness. We don't exactly know why that happens, but your body's doing some work behind the scenes to kind of heal itself up. So I have lots of patients who say after they leave treatment, they might go and lay down for half an hour. Sometimes if they normally go to bed at like 10 o'clock, maybe they'll start going to bed at 9 o'clock. I've heard people describe it as sort of that feeling like you've been out in the sun all day. So it's not completely debilitating, but it's definitely real. And sometimes that gets a little bit more pronounced in the second half of treatment. Depending on where we're treating, again, if you have skin issues, we have loads of different creams that we have on site that we can give you. We also have loads of different options for medications to manage any side effects. For example, I treat a lot of cancers in the abdomen and pelvis. I don't see a lot of skin side effects, but I do see a lot of things like diarrhea, cramping, and sometimes nausea and vomiting. But luckily these days we have so many different options to make people feel okay and make it through their plan so that they can move on with their lives after their treatment. This is an example of a dermatitis or skin irritation caused by radiation. It is quite common and a known side effect in treating breast cancer. Unfortunately, that's just one of the sort of targets. That's one of the areas that we want to treat in breast cancer because, gosh, we don't want it to come back on the skin. Other side effects when we treat breast cancer can include some swelling of the breast we're treating, some nipple irritation, again, that tiredness. But with breast cancer treatment, we don't expect any nausea or vomiting. And again, no hair loss. So I mentioned at the beginning the different types of radiation therapy. We also use that stereotactic or pinpoint high dose radiation. And we also use the brachytherapy, which is the internal or close radiation. And really that's just determined based on what type of cancer you have, what stage, what other treatments you're also receiving. Again, most patients do receive external beam radiation. This is an example of what it looks like to lay on the table. Oftentimes we have your arms up over your heads, but certainly if that's not a position that's comfortable for you or your loved ones, just let us know. We'll put them by your sides. And again, we would take some images before starting. Here's one of our lovely therapists, and then we would deliver the treatment. Stereotactic treatment, like I said, is that pinpoint treatment that's given over a shorter period of time. It was really developed for cancers in the brain, but over the past, I would say 10 to 12 years, it's been developed, tested, and approved widely for other body sites, including curative treatment for lung cancers, liver cancers, as well as other sites where cancer maybe can spread. It does require a bit longer of a planning time between that CT simulation and treatment start. And like I said earlier, it does require a bit longer of a time to lay on the table. So it's not a great option for like emergent treatment, but it's a fantastic option for integrating with other therapies and for certain types of cancers. And then again, this brachytherapy, this is something really that VCU is a pioneer in. We use brachytherapy for breast cancers to give the shortest possible treatment. I personally use it for GYN cancers, so complicated cancers that can't have surgery, as well as treatment after surgery for some higher risk cancers. We do a lot for prostate cancer, as well as things like skin cancers, sarcomas, and even pancreas cancer. So lots of exciting stuff being done. But really the elegance of brachytherapy is you're putting a radiation source right into or near the tumors. So you're giving a hugely high dose with an excellent chance of controlling the cancer and a very low risk of side effects because the dose just falls off so quickly. So depending on the indication, obviously it's not appropriate for everybody, but it is a really nice option. Again, I already said most of this, but this is Dr. Arthur, our chairman, performing a breast brachytherapy case. We have this procedure suite in our department, so it doesn't involve a trip to the operating room. We do have anesthesia support because obviously nobody wants to do this while they're awake and feeling pain. And I think I mentioned most of these indications, but we've also done some esophageal cases, as well as anorectal cancers. So lots of great things. Now, just some general tips to kind of wrap it up. I mentioned a lot of these, but while you're undergoing radiation or preparing to go through a course of radiation, just make sure you talk to everybody, ask your questions. We know that this is a new experience. It is day to day for us, but it's quite intimidating. So just let us know what you need. I get this one a lot. People say, well, I read I can't wear deodorant, I can't wear my lotion, I can't take showers. Wear your deodorant, you'll be just fine. And then certainly things like sunscreen and cover up the treatment area while you're in the sun is very important. I wouldn't make any radical changes during this treatment. Keep eating, drinking, exercising, and take all your normal medicines. As I said before, try not to peel off those radiation stickers. If they come off when you're in the bath or the shower, just let us know, no worries. And one of the important things with radiation is really to try not to miss an appointment once you've started in a program, because it works the best when you go from start to finish in your program with the minimal amount of gaps. We do give you off for weekends, so you only have to come Monday through Friday for most programs. And of course, there's exceptions when we have holidays and things like that. And then again, just don't sit at home and worry. Just call us, just ask. I think we're super available, and our goal is to get you through this treatment as best as possible. So here's just some additional resources. Obviously, our website is phenomenal, masseycancercenter.org. ASTRO is our national organization for radiation oncology, and there's some really nice patient education videos. If you can't find them or have additional questions, just ask your doctor. We can even play them in the room and walk through them together. And then cancer.gov is another great site, but a bit more general information about radiation oncology there. Thank you for your time and for watching this. Again, I'm Emma Fields, and I'm at Massey Cancer Center in Radiation Oncology. If you have additional questions, feel free to reach out to the Ask Massey at vcu.edu account. That account is monitored daily, and we will get back to you. Again, if you're preparing for treatment, though, feel free to just come on in or give us a call directly. Thank you. Bye.